In going to sleep, or do you wake up in the middle of the night and then lose sleep, or do you wake up in the early morning and then lose sleep? Three things. If it is difficulty in sleep, probably it is because of the initial thinking, anxiety, tension. So probably a calming agent or something which acts immediately might help. But suppose this person is getting up in the middle of the night, passing urine, prostatic problem, getting up and then lying, trying to sleep, thinking of various things, not getting sleep. Doctor usually gives a control release drug so that it takes over. And most importantly, if it is early in the morning, you'll have to think of depression because early morning awakening is a sign of depression. So you'll have to go deeply into the history and find out whether the patient is really depressed, the cause, and the cause has to be corrected. In any case, the cause has to be corrected. Sometimes elderly people is very, very difficult. And people say, will I get habituated? Will I get addicted at the age of 80? These drugs are meant for people at this age and the doctor knows to give. So immediately if your sleep is required or you are watching a TV and then like to go to sleep, probably a sublingual tablet which calms you down and initiates sleep early within 10 minutes would be ideal. Or middle of the night, a long-acting drug which acts controlled release will be an ideal thing. Along with the other forms, meditation, more important than medication in most people, especially elderly, shavasana, whatever they learn. Gradually a month and then withdraw that. Early morning awakening, one has got to look into it. See, it's all a habit. My dad used to say, habit is a wonderful word. Habit. You remove H, a bit still remains. You remove A, bit still remains. You remove B, it still remains. Very difficult to get out of a habit. And when somebody was formulated and then is built up like that, attitude is like that, and then always worrying type, it is very difficult. They need counseling. Counseling doesn't work initially. Medication are required, and then this has to be addressed deeply by the doctor, with the counselor, and with the patient's cooperation. So, what I'm trying to tell is a general those thing that this is often missed and patients suffer. What happens if you don't sleep? I have had this problem before. Even times now I get this because I was used to reading late into the night, early morning also. So naturally, it still continues even now. If I can wake up late tomorrow, if I start on something, I'll finish that and then only look at the time. And then I know that I can sleep a bit later. If I don't get that sleep, naturally what happens? Somebody going to sleep at 4 o'clock, 6 o'clock, getting up, naturally they'll be tired, exhausted, and the patients will not tell this, but they'll say, tired, exhausted, you do all the tests, everything is normal. Miss out on the cause. So in medicine, always the cause. Unless the cause is corrected, there is not going to be long-term cure for the problem as such. So I feel that patients should write down their problems correctly. Sleep, very important, and that has effect on the next day, continuing days. That can lead to depression, irritation, anger, and then frustration. People ask why is like this. Fellow has not slept at all. No sleep at night, worrying, daytime showing out. So that concern and then correct diagnosis and then the management is very important in medicine. So I just conveyed the outline. I'm sure that it will be of some help to you when you're meeting your consultant with your problems, especially the elderly. Have a nice night.